in the last 7 to 9 years, or let's say 10 years, the technique of spinal surgery has evolved so much that today, after major spinal fixations, we make the patients walk on the very next day, and we insist that they should not take rest. It is the other way around now, because it has been proven that early mobilization after spinal surgery gives you better results. Early mobilization, joining work early, allowing these patients to travel early and to engage in normal life activities is the key to success to spinal surgery.
Hello, I am Dr. Meenal Raze, physiotherapist. Today I am going to discuss about post-op physiotherapy after spine surgery. After spine surgery, physiotherapy is very important. It plays a very important role after the surgery to reduce the back pain, to reduce the back stiffness which is there for few days after the spine surgery. So on the first day, once the patient is in his room, on the first day the physiotherapist helps how to roll on, how to lie down on one side, how to put the belt, lumbar belt, and how to get up on his own or with the support of a physiotherapist. The recovery time period, it depends on patient's age. If the patient is, like for example, if the patient is 40 and if the patient is 60, according to the age, his age or his physical fitness or the type of injury, the physiotherapy exercises slightly differs. Even the physiotherapist helps how to use toilet, even how to climb the stairs, how to ambulate. Because after the surgery, to reduce the back stiffness, back pain, physiotherapy is very important. It even helps, the exercises helps to reduce the thrombus formation in the legs, which is called as deep vein thrombosis. After any surgery, there are more chances or more complications of this DVT. So weekly or after 7 days or after 15 days or after 21 days, the physio protocol changes. According to the patient's strength, the exercises pattern also goes on changing. And for this, if you have any queries, you can definitely ask or you can comment. We are here to help you out. So just now I am going to show you a few moves, okay, after the spinal surgery. How you can get up, how you can do the squatting, how you can lift the things, okay, if they are on the floor. So first I am going to show you how to get up from the bed. So suppose you are lying down, so do not turn or do not get up immediately. First of all, initially you do few movements of your ankles, then leg movements, okay, each 10 repetitions, and then after this you can bend your both knees, keep a pillow between your both knees, hold your hands together tight. If nobody is there, you can get up on your own. So hold the pillow tight and just take a deep breath, and 1, 2 and 3, just rock low. Okay, similarly if you want to go back on your back, same thing, 1, 2 and 3, just log roll, so that there will not be any twisting. 1, 2 and 3, and then you take out your legs and support yourself and get up. Take out the pillow. This way you can get up on your own after the surgery. Okay, so now I am going to show you how to squat down and pick up the thing. If it is more than 1 kg, do not try to lift it up till your surgeon says that you can bend and you can lift heavy things. Okay, so now first of all thing, do not bend forward and try to lift the things. You have to squat down, bend from your knees, go down, go on your toes, pick up the thing, take a support, or otherwise if there is no support, then just push yourself up.
Now let us see what are some of the do's and don'ts after spine surgery. If somebody taps you from behind, don't turn your spine. You have to turn your whole body While trying to sit down on an elevated surface, always use a pillow underneath your buttocks to give you a little bit of elevation so that you're able to sit cross-legged. While trying to sit on a couch or on a sofa, don't leave any gap behind your back. Use a small pillow as a support.
Of course, there are some spinal surgeries very small in number, which definitely require rest after surgery. For example, when we operate on a spinal problem due to tuberculosis and the spine has become very weak because of infection, in that case, even if we perform decompression and good fixation, we have to request patients to be in bed rest for some time. So, but these are exceptions. These are not the rules. These are exceptions. So generally, if we operate like, for example, we perform endoscopic discectomy, you know that we discharge the patient immediately in next few hours and the person is, allowed to join work the very next day. Microscopic discectomy, also 1 hour day here and there, they are allowed to join the work. Discectomy with fixation of spine when it is needed, indicated in that particular case, people can join work within 5 to 6 days or 10 days at most. Extensive correction of spinal deformity, people can join work within 20 days. So these are very major spinal surgeries. And another example is spinal tumors. Now, about a month back, we operated on a very young person with intramedullary tumor, this tumor which was inside the spinal cord. And that person, who is an IT engineer, he had joined work within 20 days, a very, very major spinal surgery. So, the way we look at spinal surgery has to change because of the changing circumstances. Otherwise, we will never be able to avoid problems which these pathologies create.